Yoga to shrink enlarged prostate? An enlarged prostate, medically known as benign prostatic hyperplasia, BPH, is a common condition in men as they age. It can cause urinary symptoms that impact the quality of life. While medical treatments are often necessary, lifestyle modifications, including yoga, can help manage symptoms and promote prostate health. This video explores how yoga can benefit those with an enlarged prostate, detailing specific poses and practices to support prostate health. BPH is the non-cancerous enlargement of the prostate gland, which can obstruct the flow of urine and cause urinary symptoms. Frequent urination, especially at night. Difficulty starting urination. Inability to completely empty the bladder, most common in men over 50 years old. Changes in hormone levels, particularly an increase in dihydrotestosterone, DHT, contribute to prostate enlargement. Diet, physical activity, and stress levels can influence prostate health. Benefits of yoga for prostate health. Improved blood circulation. Yoga enhances blood flow to the pelvic region, promoting better prostate health and function. Improved circulation helps reduce inflammation and supports tissue health. Stress can exacerbate BPH symptoms. Yoga incorporates relaxation techniques that help manage stress. Lower stress levels can reduce the severity of urinary symptoms and improve overall well-being. Hormonal balance. Certain yoga poses and breathing exercises can help balance hormone levels. Maintaining hormonal balance is crucial for prostate health and can slow the progression of BPH. Pelvic floor strengthening. Yoga strengthens the muscles of the pelvic floor, which support the bladder and prostate. Stronger pelvic floor muscles can improve urinary control and reduce symptoms of BPH. Happy baby pose, or Ananda Balasana, is a gentle hip opener and calming pose that helps to stretch the inner thighs, groin, and lower back. This pose is often included in yoga practices for its soothing and relaxing effects, mimicking the joyful playfulness of a baby lying on its back. Start on your back. Bring your knees toward your chest, bending them so that your shins are perpendicular to the floor. Grab your feet. Reach up with your hands and grab the outer edges of your feet. If you have difficulty reaching your feet, you can hold onto your ankles or use a yoga strap looped around your feet. Gently open your knees wider than your torso and bring them toward your armpits. Keep your ankles directly above your knees, creating a 90-degree angle. Relax and breathe. Hold the pose for 30 seconds to 1 minute, breathing deeply and relaxing into the stretch. Digestive aid can help stimulate the digestive system and alleviate gas and bloating. Butterfly pose, or Baddha Konasana, is a seated posture that focuses on opening the hips and stretching the inner thighs and groin. It is a classic pose in yoga practices and is known for its soothing effects and ability to improve flexibility in the lower body. Start seated. Sit on your yoga mat with your legs extended straight in front of you. Sit up tall with your spine straight. Bring your feet together. Bend your knees and bring the soles of your feet together, allowing your knees to fall out to the sides. Hold your feet with your hands. Pull your heels as close to your pelvis as comfortable while keeping your spine straight. Open your hips. Press your knees gently toward the floor, feeling the stretch in your inner thighs and groin. Avoid rounding your spine. Hold and breathe. Hold the pose for 1 to 3 minutes, breathing deeply and relaxing into the stretch. Release. Posture improvement promotes better posture by encouraging a straight spine. Stress reduction helps to relax the mind and body, reducing stress and anxiety. Supta Baddha Konasana, reclining bound angle pose. This pose opens the hips and improves blood flow to the pelvic region. Bring the soles of your feet together and let your knees fall open to the sides. Place your arms by your sides, palms facing up. Relax in this position for 5 to 10 minutes, breathing deeply. Relieves tension in the pelvic area and promotes relaxation. Malasana, garland pose. This deep squat stretches the hips, groin, and lower back. Stand with your feet slightly wider than hip-width apart. Lower your body into a squat, bringing your hips as close to the floor as possible. Press your elbows against your inner knees and bring your palms together in front of your chest. Hold the pose for 1 to 2 minutes, breathing deeply. Promotes relaxation and relieves tension in the lower body. Virasana, hero pose. Kneel on the floor with your knees together and feet slightly apart. Sit back between your feet, resting your buttocks on the floor. Place your hands on your thighs and sit up straight. Hold for 1 to 2 minutes, breathing deeply. A soothing breathing practice that calms the mind and reduces anxiety. These are some poses for practicing yoga for prostate health. Consistency is key. Practice yoga regularly, aiming for at least 3 to 4 times per week to see the best results. pay attention to your body's signals and avoid pushing yourself into discomfort or pain. Combine with other treatments. Yoga can complement other treatments for BPH. Always consult with your healthcare provider about your overall treatment plan. Drink plenty of water throughout the day to support urinary health and overall well-being. Eat a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. Avoid excessive consumption of caffeine and alcohol, which can irritate the bladder. Yoga can be a valuable addition to the management of an enlarged prostate, offering benefits such as improved circulation, reduced stress, hormonal balance, and strengthened pelvic floor muscles. By incorporating specific yoga poses and breathing exercises into your routine, you can support prostate health and may alleviate symptoms of BPH. Always consult with a healthcare provider before starting any new exercise regimen and practice yoga consistently to experience the full range of benefits. If you received value from this video, please like, subscribe, and comment.